I do look like I'm in a different room, don't I?
Yeah, the window.
It's modern technology, and we're actually in different rooms.
We could say we were in different rooms. We're not.
We're different. All right. Oh, we have people there. I see Mike Aldridge, who says he already has some questions lined up for us.
Oh, good.
Hey. Said hi, ladies. I like it when people call us ladies.
I do
It's very
too.
flattering.
They don't know us very well.
I know. Hi, Nat. All right, we are just going to give it a minute before we get started so we can let everybody log on and fulfill their wildest pandemic dreams via Facebook Live.
Via Facebook Live.
This is also where we fix the weird hair things, right?
Yeah.
All right. We're just taking notes. Hi, Valerie, Nancy, Mary Jean, Jessica. It is fun to see everybody say hi. So nice. All right. Do we want to? Okay, so we're setting ground rules to start with. So no fighting, no talking. If you bring food, share with others. Just kidding. So Destiny and I are going to do this again in a couple of weeks, but we are trying to shorten it, compact it into about 15 minutes. So we really want you to ask any questions right off the bat. We're going to keep watching. Oh, are you logged in already?
No, totally.
We're gonna keep watching those questions. We want you to ask right off the bat if you can, and we're gonna give statistics and information, and we'll address the questions as we go along. But we know that things are constantly changing. We know that there's not like huge news right now, but we're going to give you an update. We skipped a couple of weeks ago, so we took a little break. But we want to give you all the information we can in a short amount of time, so we can all get back to living our lives. So there's Dr. Bernstein. Thank you. All right, so we're going to start off. So that means that we're going to try to limit it to about 4:20. Does that work?
That works.
All right.
All right.
So Destiny's going to tell us about statistics.
Yay! Okay, so national statistics, according to CDC today, are 6,004,443 cases. A lot of zeros in the middle
That's
there.
a lot of commas.
4,443 cases. With a little over 183,000 deaths. So not great numbers nationwide. In Kansas, not that one. Sorry, I'm looking at the computer. As of yesterday, we had 42,612 cases. We have 446 statewide deaths. And I forgot to look up the county statistics, but I know that we have 15 active cases, right?
Yeah,
Yes.
15 active cases.
15 active cases and one person hospitalized right now. So,
All right.
and I'll look up the actual numbers because it was somewhere around 30, I think.
All right. And Mike Aldridge has us started with some questions, and we'll definitely get to those. And then, like I said, we're going to share some information that we think might be pertinent. And then if you have any other questions along the way, thank you for sharing, and we'll get to them. And
38.
Oh, 38 total.
38 total.
So we do want to say thank you. We see a lot of people on here that are doing hard work in COVID stuff. Kim Smith is our infection control at our hospital. We have doctors. I think I saw Brent from California as well. So we've got lots of people from all over the place. So welcome to our little world. We do have our little plexiglass thing here, just in case you didn't see it. Let's see. So first question from Mike is, for a COVID positive person, are the symptom presentation, speed, and severity of symptoms an indicator of disease progression / outcome? Let's see. Are the symptom presentation, speed, and severity of symptoms?
So if they get sicker faster, will they
Yeah.
stay super sick? It's a really good question.
It's a great question, Michael. I don't know that we have that answer. I'm not sure that answer is available, but we can find out for you. So thanks for stumping us right off the bat. And the reason we say that is because there are, it depends, like any disease. If you are like at baseline very healthy, in general you fare better. Now, COVID is not the most fair player out of all the viruses out there. So we do see healthy people that do get severe disease. We see people who are in their 80s and 90s even that do just fine. And so we can't really say, because we also see people that get better and then take a turn for the worse. I mean, there's just so much up and down.
Yeah,
So,
and we see that when we monitor people in isolation, they'll be like, oh, I'm fine, I just, went in for kind of nothing, and then they feel better, and then they're like, oh, I just felt awful for a few days, and then they get better again. So
yeah,
it's kind of...
And sometimes those declines are pretty rapid as well. Yeah, like Destiny said, you'll feel great one day, and then just kind of plummet, but then maybe get better right away, hopefully. All right. Okay. Keep the questions coming, everybody. Thanks for everyone joining us. Destiny, we're going to talk about a little pandemic lingo.
We are. Okay, so Wilson County has 33 confirmed positive cases. That means we have 33 tests, positive tests in people. We have 5 that are presumed positive. So to be a presumptive positive, you have to live in the same household as someone who has tested positive. You have to have similar symptoms, and you have to have them at the same time. So we can't say, oh, my husband was sick 2 weeks ago and I have COVID now, so he probably had COVID. It's got to be around the same time. The reason that we do presumptive positives is because some people don't want to get tested, and that's okay. We're not going to force anyone to test, but what we are also not going to do is not consider the fact that they probably have it. That's why we call them probable cases, and we do keep track of them separately. So it's not a number inflation or anything like that. We're not adding them into our total case counts specifically. We are keeping them separate, but if we didn't report them, it would be more like hiding them, and we don't want to do that either. So we're trying to be transparent and honest with the numbers, I guess.
And if you'll remember, when we started doing this thing and we were like, should we do Facebook Live? The first thing I think we said was, we just want to tell you everything we know, and we want to be transparent and share the information that we have. So that has continued, and we'll keep doing it as long as we need to.
Yeah, and sometimes we're wrong.
And sometimes we're wrong.
and we're pretty good at admitting when we're wrong. So
yes. Alrighty. So continuing with the pandemic lingo, one thing that I wanted to bring up was what we call super spreader events. And so that is something, there was a kind of a write-up from the University of Nebraska, and they mentioned 3 different things, the 3 V's: venue, ventilation, vocalization. And so what that means is super spreader events tend to happen when people are kind of all indoors for the entirety of the event, and it's hard to social distance. When there's limited fresh air, like they don't have like open doors or windows and things like that. And vocalization, there's lots of talking, yelling, or singing, and those are more dangerous in spreading than just normal talking, or people sitting around like in a conference and listening to a boring lecture or something like that, right? So the thing that we learn from that is we've seen these events happen where we see multiple cases result from the event. And so if you find yourself planning to go to an event like that, just remember those things. If you are in a venue or at a venue where it's mostly indoors, make sure that you don't stay indoors the entire time. Keep your distance from people, and hopefully you'll only go to smaller gatherings. Ventilation, if the venue can have filters that can filter the air, that's even better. And minimize recirculation. There was an extra syllable in there. Recirculation of air. And then vocalization, if there is going to be lots of talking, yelling, singing, that kind of stuff, make sure to wear a mask. Try not to sing. You can sing at home, and avoid loud places where you're going to have to talk over like loud music and other people talking. So just if you hear that, I mean, that's kind of a thing that we're learning, and that's why, which kind of leads into our mandates from the state right now. That's why the state right now is saying if you have traveled to an event that is 500 people or more, then you should be quarantining.
Yeah, or if you've attended an event. They changed it where it used to be out of state, and they changed it to where it was in-state events as well. So you have a travel quarantine.
All right. And Kayla, you mentioned on there if that is all true, we're talking about super spreader events. Why are we sending our children back to school? It sounds like all those apply to school procedures. Maybe I'm thinking wrong. So I guess I will just start by saying that we have them broken up into classrooms where they are smaller numbers of people. We're cohorting people, so it's not like 500 kids in one gym that we keep locked in there the whole day. They are wearing masks, so we're doing that. We are getting them to keep their distance as much as possible. We do have filters in the school, and right now we're having to be very careful with like any singing and loud talking and things like that, with even farther distances if we are doing any of that.
Yeah.
What else on that?
I think that's a lot of the main thing. I think the travel mandate specifically, so I'm going to pull it up here. Where is it?
While she's looking at that, if you've also gone to Aruba, good job, because that sounds like fun, but you also have to quarantine. That's the only other place right now that's on the travel quarantine list on or after August 27th, it looks like. So
yeah, so if you go to Aruba, plan to
maybe just stay there a while. Make it worth it.
Right now. Although I'm guessing they're on the travel mandate because things are not great there right now. So maybe not the best time to go to Aruba. This still says out of state.
Oh, okay. Well, I think we'll clarify with that.
That's really odd.
If it's 500 people or greater, out of state or in state also, is kind of what we're trying to figure.
Yeah.
Okay.
Yeah, I mean, it said it was in state the other day, so I don't know what's happened there. But
we'll try to clarify that one.
Pretend I didn't even look at
Nope.
that. No. So the other thing with that is that the schools really are trying to practice that social distancing piece. Is it perfect all the time? No, but they are all trying really, really hard. Oh, only out of state at this time. So thank you, Cassie. Sorry, I thought that they changed that. So only out of state right now.
For the 500 or more gathering with a mandated quarantine. Anyone can quarantine. If you feel like we're somewhere and people are coughing and doing bad things, you just go ahead and quarantine yourself. I mean, if you want. You don't have to.
You don't have to.
Yeah, but these are mandated quarantines.
Yes, yeah. Okay, so go ahead.
Oh, I did have on my list here that we just wanted to kind of give a shout out to our kids. Like, our kids are doing amazing at wearing their masks. And I think, when kids wear masks and see their friends wearing masks and they're encouraged to do it by their teachers and all that, I mean, they're doing great. And I love that we have given our kids the opportunity to show us that they can do it. I mean, that's the really cool part. And they get it. And if they don't fully get it, they get that all the other kids are doing it, and it's something to keep people safe. So please keep encouraging them. It's amazing, and it's really cool to see them do that.
Yeah. And while we're talking about schools, Diane, I'm going to answer your question really quickly because it goes, will the public be informed if there's a positive student? I know school protocol will be followed as it is required, but I've noticed the news stations are announcing positive tests in schools. If anyone is notified of positive tests in schools, the schools will be doing the notification. Just like we would handle it the same way if there was a positive case in a long-term care facility. We are not going to say anything. That's up to the facility themselves. So we're not going to post that. The only time we would ever, really ever, post if you were here, then you could have been exposed, would be if it was one of these sort of super spreader events where we were like, oh, there was a concert in Bateman Gym.
You know those concerts.
You know, and, 15 people have tested positive so far. If you were there, there were probably people that were infectious there. If you start feeling ill, call the health department, call your doctor. Those kind of announcements. We've seen those from COVID and other diseases as well. But in those types of events, we would say a specific place. But until that point, it would really be up to that facility.
I think this is a great place to talk about how, why we're able to communicate with the schools. The health department can communicate with the schools. It's a fine balance between keeping, people's privacy secure, but also keeping the general public safe. And so Destiny's going to tell us all about that.
So schools are and have always been mandated infectious disease reporters, as are health departments. And labs, everyone who is working on that. So we can contact the school and let them know that they have a positive case, and the school can contact us and let us know, because it's protecting the health of all of the kids in the school, and therefore public health.
And there are certain diseases that this has just always been the case. And so
COVID, chickenpox.
Yeah, chickenpox is one. I mean, COVID is categorized under that as well. So that's good for us, because otherwise we would say, well, there's, maybe a student in Wilson County that has this, or this is the age group. And then in theory, if we were not able to share any of that information, all the schools would just kind of have to shut down, and not knowing which school it is, or which grade level, who they've been in contact with, that kind of stuff. So it's really in order to keep our kids in school longer, the most number of kids possible in person school.
Okay, so you want to go back and get a couple?
Yeah, I know Michael asked about there is some data out there, or news out there, I guess, that's saying that there are actually 10% more positive cases out there than what are reported. And is that the case, or is it actually a higher number or lower number? Truly, we don't know. It would be my first answer, but it really all depends on the testing, right? So we also we know that, like Destiny talked about earlier, not everybody is even wanting to get tested. We would love for everybody we'd love to test everybody every day and just make sure we know exactly who in the world has this, but we can't do that. So right now we're mostly testing symptomatic people, and not even all those symptomatic people are getting tested. So maybe they are quarantining, maybe they're not, and they're out there spreading things. We hope not. But definitely we most likely have more cases than what we know from the data that we have.
Yes. Yep. Are new therapies improving outcomes? Randy Hunt asks.
Randy, that's a good question. We are seeing less deaths relative to the number of cases that we're seeing. So we're seeing the case numbers going up, while the deaths are not going up as much as the cases. So number one, we're able to test more, and we're also testing more asymptomatic people, like kids going back to college and things like that. We're getting numbers from there, and they're relatively healthy, hopefully, until they start college. I'm just kidding. Anyways, but then we also know that we know how to treat COVID better in our hospitals, like at KU Med and at Via Christi and Wesley and all those. They know how to do things earlier. So it's not necessarily that we have better treatments or magical drugs. We are using some of the medications that have been shown to help in severe cases. Remdesivir, I believe.
Remdesivir and hydroxychloroquine. And then the convalescent plasma.
Yeah, convalescent plasma. Yeah, that's like where you put people's plasma in you that already had COVID, which I think is just kind of a fun, weird thing, isn't it?
It is.
Yeah,
it is.
But so if you've had it, donate plasma. Everybody can benefit from it, hopefully. There's no perfect treatment yet, so but we just know how to kind of support people better.
Mm-hmm. Then my Aunt Corrine asks, how long can...
I was like, who's aunt?
My Aunt Corrine asks, how long can you test positive after you recover COVID, and honestly, quite a while. The tests that we use are pretty sensitive, so they pick up viral particles, and so you can continue to test positive even after you're clinically recovered. And we've seen that a few times. That's why the health department is not like, if you want to go back to work, go test negative. Yeah, that's not what we're. That's a good question. They are. I lost my train of thought. Teresa, your question was good, and so I forgot.
Like testing, how long?
Oh yeah. So it could be up to like a month.
Mm-hmm. And actually, I think right now, because the health department put out something about people quarantining and things like that. I think they don't even recommend retesting for symptoms even within a few months. Do you remember that post? But, I mean, if there's a reason like that you need to retest.
If you completely recover, and then it's been over 30 days, and you get sick again, which is uncommon, but can happen. Then you can get tested again, and if it comes up positive and it's been 30 days since you recovered, they'll count you as a new case again, because they'll assume you got it again.
But they will. I mean, our state has told us that they actually file it still under you, like Destiny got it and then Destiny got it again. Not like, oh, here, let's make that two different cases. Right. So again, we want to make sure.
No, if it's after 30 days, it'll be another case.
I think they still link it.
Oh yeah,
they link it to
yeah,
the
it's all by name and date.
Yeah. So let's see. Okay. Speaking of, there was a question about face shields. Is it?
Oh yeah.
If you want to do that one.
Yeah. So the question was, is it better to wear a mask and a face shield if you're in a small gathering? And the best PPE is a mask and a face shield, because we know that these airborne droplets, basically to your face, is the best way for you to get it. So if you're wearing safety glasses or face shield or whatever, and a mask, then that's definitely going to up your chances of not getting or spreading it.
So like when we treat people or we swab people, we have an N95 mask, a face shield, we have a bouffant cap, we have a gown on, we have gloves, and we have booties. Like, it's super, super sexy.
And cool.
And
it's
cool.
So cool outside.
Cool,
yeah,
yes.
when it's hot out, it's the perfect thing to wear when they're swabbing you in the parking lot.
Yes. Do you want to touch on? They asked about active cases and if they're linked.
We do have 15 active cases. Lisa, I saw that question, and then Teresa. Some of them are household contacts, but some of them are completely unrelated. So we got 8 new cases yesterday. Knock on wood, we've not gotten any today. You hear me knocking? Yes, Mondays tend to be our busiest days, and I think a lot of it's because people aren't going to go to the emergency room on the weekend unless they're really sick, which is exactly what we want from them. Like that the emergency room is for emergencies. So then they wait till Monday and they go to call their physician, or they go to the lab and get tested on Monday. So we get a lot more cases on Mondays than other days of the week. But so I'm trying to think of how many were related. Ugh. There were like 4 in one group, and like
all your
2 or 3 all your reports in for the day.
Well, we can. So, Lisa, there's kind of like not a. The question is, are all your reports in for the day? There's not really like a stop to the day. We test in the ER and all that throughout the night and everything. But as far as the health department reporting, they report at the end of the day
by the cases as of, I think, 4 o'clock, 4:30 maybe, Monday, Wednesday, and Friday.
And then have any of the active cases recovered since yesterday?
I think at least 1 recovered today.
All right.
I'm sorry.
It's real. Like, as the numbers go up, it's a little
harder to keep track. But COVID toes. Yes. So I don't know a lot about COVID toes.
Gwen, COVID toe is a thing. It's not probably like the. Cassie, you spelled that wrong. Anyways. Gwen, COVID toe is a thing, and it's weird, like, because we are finding that COVID is not all respiratory. I mean, we've talked about this kind of along the way, that it has a lot to do with the vessels, the blood vessels, and inflammation, and the heart, and everything else. And so it's another weird thing that we have seen with COVID. And speaking of that, I think a lot of people will say, oh, well, only 1% of people, die from COVID, or, originally we thought it was 2 or whatever. We see in a standard flu season about 0.1% of people who test positive for flu die. And so this is 1%-ish, and we're still gathering the data. That's why I'm kind of saying ish, because we as we test more people, we are more accurate with our numbers. But people might say, well, only 1% die, so what's the big deal? I say this often to my patients who smoke, and they say, well, I'll die from smoking. What's the big deal? I enjoy smoking. The problem is that people don't just die of smoking. They die of they might have a stroke. They might end up on oxygen and have trouble breathing. They might have a heart attack, things like that. So with COVID, it's a similar thing, that you might not just die from it, but you might have long-standing issues for a while. There was one study, and we have kind of our data here around us, but there was one study where they had 100 people who had recovered from COVID, and they were kind of in their 40s, 50s, 60s, I think, somewhere in there. And what they found was that up to, and I need to find it in there, it was up to 78 of those patients, of the 100, had cardiac imaging, so imaging of their heart, MRI imaging of their heart, and 78 of those 100 patients had heart issues afterwards. So they recovered from COVID. They didn't die. They felt okay, but they had heart issues afterwards. And then 60 of those patients had continued inflammation in the heart tissue. And that's a small study. 100 patients isn't a lot. But that's just an example of why we can't take things like this for granted and say, well, only 1% die. Well, what about the other complications that go along with it? So please just be very aware of that there's a lot more that goes into it.
Yeah. We are down. We're actually 8 minutes over.
We're
so the
bad.
last 2 minutes.
Okay.
There's one more question. From Vicky, if a family member has COVID-19, what are the chances of other family members becoming positive? I'm assuming you're talking about household members, and really it depends on a number of things. How quickly the person who's positive catches the fact that they're positive, how quickly they get tested, and how quickly they get quarantined or isolated, and how well they isolate from their family. So when we talk about isolation for positive folks, or even if one member of a family is quarantined and the rest aren't, because that person was exposed and the rest were not, we talk a lot about increased sanitation, wearing a mask even in your home when you leave your bedroom. Like, if a lot of times people will be like, well, I'll just sit in my room and watch Netflix and my husband can cook all the meals.
Not the worst, not the worst.
But if they do that and they only come out and they're sleeping in separate rooms and they're really, really being consistently quarantining themselves from their family, really, I mean, the odds are no different than like an office mate. Mm-hmm. But in some cases, people don't feel well and they think it's just a cold or it's allergies or whatever, and then their kids come up and they hug and kiss their kids and their family and they lay together on the couch, which are all very healthy things to do. Mm-hmm. Just not necessarily when you have a virus. So I would say it really truly hinges on how strict people are with their isolation and how quickly they catch their the fact that they have the virus.
Yep.
Yeah.
There was a flu shot question too.
Yes. So ACIP is actually recommending the end of September or beginning of October this year. In the past,
Explain what ACIP is.
Huh?
Explain what ACIP is.
Oh, I'm sorry. The
American College of, I think it's immunology.
Immunization practices.
Okay. Anyways, people who are in charge of immunizations.
Yes, they give all the immunization recommendations. That's what the health department follows. And they, American Committee on Immunization Practices.
Oh, there we go.
Sorry,
Hey.
Took me a minute. It's a long one. But But yeah, so they are recommending that we actually wait a few more weeks. We actually have gotten a few doses of flu in already, and they are recommending waiting till the end of this month or beginning of October to do that. And shameless plug, the health department's drive-through flu clinic is back. Yay! And we're going to do that in October. So watch the newspaper and Facebook, and we'll have that out when we do that. It's on a Friday from 10 to 2, and you can just drive right through. You don't have to get out of your car. So
awesome.
That's a shameless plug for the health department.
Was there one more in there? You had mentioned that there were a couple in there.
I think I was kind of trying to write them down.
While we're looking at that, I do want to point out that they, let's see, Yale did get an emergency use authorization from the FDA to do saliva-based COVID testing. We don't have that here yet, but we're hopeful that that's going to be something easier, so you don't have to do the whole swabby swab. They'll just get your saliva, and that will be nice, and it's supposed to be very affordable and cheap. Anyways, just kind of watch for that on the horizon. The other thing that I was just going to mention, there's a lot of stuff out there right now from the CDC and what people are dying of and things like that. Just be very careful in what you share on social media, and really make sure you're analyzing the data well. That data on the CDC was, the reason people were pointing it out is that they said, well, only 6% of people actually died of COVID. What they also went on to point out is that 6% of those people died only of COVID. They had no other comorbidities or anything listed.
They were like perfectly healthy people.
Perfectly healthy, and that's the only thing, or that's the only thing the doctor listed on the death certificate. But in reality, most people are dying from pneumonia as a result of COVID, or heart failure as a result of COVID, or kidney failure as a result of COVID. And so that, just be very careful. No one, we want the data to be informative for you, and that's one of those ways that we have to make sure that we're reading it the right way.
Yes. And do you know the answer to that? I don't know the answer to that.
As there is a large baby, okay, just curious, as there is a large baby boom currently, not Kimber, how do COVID and nursing correlate? If a nursing mom does contract COVID, is it still safe, beneficial for them to pump nurse right away or delayed? Really, really great question. I don't actually know that. What the answer almost always is that it's good to nurse your baby. Antibodies are usually transferred to the baby as well. We will find out. Thank you.
Yes.
Great question. And congrats, Kimber, on your pregnancy.
on your expanding family.
Okay, I think we're going to shut her down because we definitely went longer than we said we were going to.
And Vicki, I think you're right. This one talks too much.
I
so
know.
15 minutes isn't long enough. But we did it in 30.
We did. That's better than usual.
That is better than usual.
Okay, but what we didn't do was show our t-shirts.
Nope, we didn't.
Okay.
Oh, I can't get her on my chair.
It says, I like to do public health stuff with my friends. If anyone can post on here what viral video this comes from but was edited for public consumption, please post it in the comments and we will give you a shout out at the next one.
Yep.
And also,
which one are you doing?
I'll do this one, maybe?
Okay, I'll do this one.
We also, again, our schools are doing amazing things. Look at these masks that the Fredonia Yellow Jackets. Yay! They gave 3 out to each of their students. They have different designs, and I mean our schools are just bending over backwards, and I love it.
They're doing an awesome job.
Makes us so happy.
Yes.
Lisa asked why only 15 minutes. We're trying to be more succinct because we talk a lot.
Yeah,
we're
trying to.
And we want people to get the questions in so we can answer, and you guys can get on your way, and then we'll get on our way.
Yeah. Perfect. So our 15 minutes turned into 30, but it was a fun 30 minutes.
It was a great time.
It was like a sprint.
And you guys asked a lot of great questions.
Yes,
Thank
good
you.
questions.
Maybe that's what we need to do. Like, hurry, this is not a drill. I think that's how it needs to go.
Yep. And we will find the answer to the nursing question because that's a really good question. I like it.
And then we will, what was Michael's first question that we didn't know either? There was something else. We'll
go back.
We'll go back on that. In the meantime, we'll be back in 2 weeks, and please, please, please take care of each other, check on each other, be kind to each other. We're, it's a stressful time for everybody. We just need to lean on each other and make sure that we're all doing okay through it, because there are people who are not.
There are people who are not.
Yeah, and so just be kind.
Love your neighbor.
Love your neighbor. Don't spread viruses. Don't love them too much.
Love them.
Like an appropriate amount.
Yeah. Through plexiglass.
Through plexiglass. Maybe a mask. All right. Thanks, guys. Bye-bye.